1. Who deserves the title doctor? The controversy in India's healthcare. 2. Are homeopaths and Ayurvedic practitioners doctors? 4. The hypocrisy of the liver doc, exposing double standards in medicine. 5. Why critics can't ignore yoga and Ayurveda, insecurity and intolerance exposed. 1. Who deserves the title doctor? The controversy in India's healthcare. A simple tribute to Doctors' Day by Indian chess Grandmaster Vidit Gujrathi has sparked a heated debate, forcing the healthcare community in India to confront some tough questions. The controversy began with a family photo, but it quickly escalated into a complex discussion about medical legitimacy, traditional practices, and institutional authority. Vidit Gujrathi, a key member of India's chess Olympiad gold-winning team, shared a photo of his family and listed their professions. This seemingly innocent act ignited a fierce debate. Gujrathi's father is an Ayurvedic migraine specialist, his mother a cosmetologist, his wife holds an MD in homeopathy, and his sister is a physiotherapist. Dr. Cyriac Phillips, known as the Liver Doc on X, responded by stating that none of Gujrathi's family members were real doctors, a bold claim that sparked a heated exchange. Maheshwer Peri, founder and chairman of Careers 360, supported Dr. Phillips, adding that there is no such profession as a migraine specialist, and physiotherapists are not doctors. This statement further fueled the controversy. The debate has academic voices weighing in, with EdXLive conducting interviews to uncover the complexities behind medical legitimacy. Professor Kishore Potwadhan from Banaras Hindu University, BHU, offers a unique perspective. He argues that when the government recognizes and runs medical courses in Ayurveda, homeopathy, and other traditional practices, with similar durations to modern medicine courses, the term doctor is appropriate for these professionals. Professor Potwadhan makes a crucial distinction between different alternative medicine systems, challenging the blanket labeling of traditional practices as pseudoscience. He emphasizes that Ayurveda, for example, is not pseudoscience, but rather a pre-science or proto-science, a knowledge system that existed before modern science. The debate also highlights the role of institutional recognition. Dr. Savendu Kumar Sohu, a homeopathy practitioner and president of the All Odisha AYUSH Students Association, questions the government's policy and investment in these fields. If the government recognizes and invests in these practices, why are they not considered doctors? Dr. Sohu reveals an interesting paradox: even allopathy doctors, who may criticize homeopathy, use it due to its lower side effects. He argues that traditional practices like homeopathy and Ayurveda have proven effective in certain cases where modern medicine falls short. Professor Potwadhan highlights what he sees as systemic discrimination in India's medical education system. He argues that modern medical science has become elitist, with biomedical education disproportionately accessible to those who can afford it. This imbalance, he believes, needs to be addressed. The debate also sheds light on the perspective of conventional medicine. Dr. Dhruv Chauhan, national spokesperson of the Indian Medical Association, Junior Doctors Network, IMAJDN, acknowledges the legitimacy of certain alternative practices, but expresses concerns about mixed practices and the prescription of allopathy medications by Ayurvedic doctors. Dr. Chauhan advocates for respect based on proper training and government recognition. He suggests that the government's promotion of certain branches gives them the title of doctor, and thus, criticism should be directed towards wrong practices rather than the entire system. The debate extends beyond professional recognition, delving into India's cultural identity and healthcare heritage. Dr. Sohu poses a challenging question: if the entire country uses these traditional practices, and the government promotes them, why is there a debate that criticizes other branches without understanding their practices and results? Professor Potwadhan acknowledges quality concerns but defends the legitimacy of traditional systems. He questions the artificial hierarchy built between medical branches, suggesting that professional divisions may be more about power dynamics than medical efficacy. The debate reveals a healthcare system grappling with multiple challenges. It's about ensuring quality care while respecting traditional knowledge, maintaining professional standards while addressing accessibility, and reconciling modern scientific methods with centuries-old healing practices. While the original exchange between Gujrathi and Dr. Phillips may have been personal, it has opened a broader conversation about India's healthcare landscape. Gujrathi's final response captures the emotional core of the debate. You and others like you do not get to decide who is a doctor. You have no authority to define others' lives or dismiss their work. As India continues to invest in Ayush systems alongside modern medical education, the question of professional recognition remains complex. The debate underscores the need for nuanced discussions that consider historical context, institutional recognition, government policy, and, most importantly, patient outcomes. Rather than dismissing entire systems, experts suggest focusing on improving training standards, preventing malpractice, and ensuring that all healthcare providers, regardless of their tradition, maintain the highest standards of patient care and professional ethics. 2. Are homeopaths and Ayurvedic practitioners doctors? Who really deserves the title doctor? A chess grandmaster's tribute ignites an explosive debate. It only takes one heartfelt message to spark controversy. On National Doctors' Day, chess grandmaster Vidit Gujrathi's warm salute to his family, many of whom practice alternative forms of medicine, unleashed a fierce public debate about what it truly means to be a doctor in India. And this is where the story gets especially contentious. Vidit shared a celebratory selfie with his loved ones on X, his father, introduced as an Ayurvedic specialist in migraines, his wife, who holds an MD in homeopathy, his mother, working as a cosmetologist, and his sister, a physiotherapist. He wished them all a happy Doctor's Day. But soon, the post attracted scrutiny as users began questioning the credentials of those he'd honored. The real spark, however, came when renowned liver expert Dr. Abby Phillips, widely known as the Liver Doc, bluntly commented, "None of them are really doctors." This sharp response transformed a family tribute into a battleground of opinions. The dispute unfolded dramatically, with Vidit defending his kin's qualifications and dedication to helping others, countering that his family had sacrificed much for his career and quietly improved countless lives, unlike those who chase online fame. Phillips, meanwhile, maintained that systems such as Ayurveda and homeopathy lack scientific validation, and accused Vidit of encouraging quackery rather than medicine. Here's the question that divides India: who counts as a doctor? Dr. Dhruv Chauhan, a spokesperson for the Indian Medical Association, IMA, weighed in with a nuanced take. He acknowledged that cosmetology does not award a bona fide medical degree. Receiving a diploma right after high school doesn't legally or morally allow someone to call themselves a doctor. However, he recognized that Vidit's tribute seemed more sentimental than official. But here's where it gets controversial. In India, practitioners of Ayurveda and homeopathy are conferred the doctor title by law. As Chauhan explained, as long as the government of India recognizes these medical systems, those with degrees like BAMS, Bachelor of Ayurvedic Medicine and Surgery, or BHMS, Bachelor of Homeopathic Medicine and Surgery, are entitled to call themselves doctors, at least within their fields. Their professional practice is governed by legislation under the Ministry of Ayush, with clear educational and licensing requirements. Yet the legal boundaries are also quite clear. Although these practitioners are recognized, Indian courts have repeatedly ruled that Ayush, Ayurveda, Yoga, Unani, Siddha, and homeopathy professionals are not permitted to prescribe allopathic, modern Western, medicines, except in very particular, state-sanctioned circumstances. The introduction of integrated Ayush universities and stricter registration for mental health facilities reflects a trend towards more stringent regulation. Ayurveda enjoys similar professional recognition in neighboring countries like Nepal and Sri Lanka, but the story elsewhere is quite different. Several Western nations, such as France, have withdrawn official support for homeopathy. France, for instance, stopped reimbursing homeopathic treatments in 2021, and many European countries now restrict its practice to conventional medical doctors or have banned it outright, citing lack of evidence. Cross-practice, where Ayurvedic practitioners prescribe modern medicines for faster results, is a major sticking point. According to Chauhan, such practices are both unethical and a key reason for public distrust. Genuine practitioners who stay true to their discipline have earned respect, he notes, but those who mix systems, commonly called mixopathy, undermine the credibility of traditional medicine. And this is the part most people miss. Even physiotherapists, after long lobbying, earned the right to use the doctor title, but that doesn't automatically place them on the same level as clinical physicians. Chauhan points out the dilemma: if massage therapists or chiropractors start demanding the same recognition, where do we draw the line? He also criticized descriptions like Ayurvedic migraine specialist, calling them misleading and questioning the broader use of the doctor title to lend unwarranted credibility. Chauhan also underscored the health risks. Adverse reactions, including serious liver or kidney injuries, have occurred with both Ayurvedic and modern medicines, often due to misuse or negligence. No medical system is immune to harm when improperly administered. On the other side, Dr. Sadaf Dinakar, former General Secretary of the Ayurveda Medical Association of India, strongly defended traditional medicine systems. He pointed out that Ayurveda and homeopathy are formally recognized by Indian law. Parliament has created statutory bodies to define their training, certification, and scope of practice. According to Dinakar, registered BAMS or BHMS practitioners are medical professionals, just like MBBS doctors. He argued that all practitioners use modern diagnostic methods, such as lab tests and medical imaging, and called it unethical, if not illegal, to publicly dismiss recognized medical systems as pseudoscience. In his view, medical professionals undermining other systems damage the profession's integrity. So, who gets to wear the white coat and use the doctor title in India? Legally, both MBBS graduates and those trained in recognized traditional systems have the right, provided they practice within their respective fields. Ethically and practically, however, the debate is far from settled, especially as social media amplifies every controversy. But where do you stand on this? Should the title of doctor be reserved exclusively for practitioners of modern medicine, or does it rightly belong to those trained in Ayurveda, homeopathy, and other traditional systems that serve millions? Is this debate about public safety, professional respect, or something more? Let us know your thoughts. Do you agree with Vidit, the liver doc, or see truth on both sides? Join the discussion below. 4. The hypocrisy of the liver doc. Exposing double standards in medicine. The hypocrisy of a self-proclaimed science crusader, a doctor who condemns alternative medicine while working at a hospital that embraces it. Imagine a doctor who relentlessly mocks Ayurveda, yoga, and homeopathy as pseudoscience, yet works at a hospital that not only offers these very practices but also promotes faith-based healing. This is the glaring contradiction at the heart of Dr. Cyriac Abbey Phillips, better known as the liver doc, a social media personality who has made a name for himself by attacking traditional and alternative medicine. But here's where it gets controversial. His own workplace seems to undermine everything he stands for. Dr. Phillips, who has built a reputation as a fierce critic of non-mainstream medicine, recently targeted Indian chess grandmaster Vidit Gujrathi. The reason? Gujrathi had shared a family photo on Doctor's Day, celebrating his parents, who practice Ayurveda and physiotherapy. Phillips didn't hold back, accusing Gujrathi of normalizing pseudoscience and dismissing his family as not real doctors. Yet, when we examine Phillips' professional affiliations, a troubling double standard emerges. The doctor is employed at Rajajayari Hospital, a Christian missionary-run institution that, ironically, offers both conventional and alternative treatments. Yes, you read that right, the same hospital that Phillips works for has an Ayurveda department, something he vehemently opposes. And if that weren't enough, the hospital also endorses yoga, another practice he frequently ridicules. But here's the part most people miss. Rajajayari Hospital goes even further by promoting a pastoral healing ministry, which includes prayer sessions, Holy Communion, and sacramental rituals as part of its compassionate care. These practices are no more scientifically validated than the alternative medicines Phillips so eagerly debunks. So, where is his outrage about this? If he truly believes in the purity of evidence-based medicine, why hasn't he called out his own hospital's faith-healing practices? Why does his criticism stop at the hospital gates? The hospital's chaplaincy page boldly states, "We facilitate pastoral care to all who come to the hospital." Our motto, "We care, we cure," is a proclamation of our firm commitment to invoke the healing power of God upon the whole person, body, and soul. If Phillips is so committed to scientific integrity, shouldn't he be challenging these claims as well? The deeper issue here is one of bias. Phillips targets Ayurveda and yoga, deeply rooted in India's cultural heritage, while remaining silent about the faith-based healing practices within his own religious tradition. His critics argue that his selective outrage reveals a cultural and ideological bias. If he were consistent, he would demand the removal of the hospital's chapel before calling for the shutdown of Ayurveda colleges. But he doesn't. And that raises a critical question: does Dr. Phillips' commitment to science only go one way? The controversy doesn't end there. Phillips has a history of making bold claims without sufficient evidence. In 2023, he falsely asserted that the National Medical Commission, NMC, had removed the Ashoka emblem from its logo, replacing it with an image of the Hindu deity Dhanvantari. He framed this as proof of India's descent into pseudoscience hell. However, the NMC clarified that the logo had always included Dhanvantari and that no significant changes were made beyond adding color. Despite this correction, several media outlets amplified his false narrative. Adding to the complexity, Phillips has faced legal scrutiny. In 2023, a complaint was filed against him during the Himalaya Wellness defamation case, alleging he lacked valid registration with the Kerala State Medical Council, KSMC. Although the complaint was later dismissed after he provided proof of his qualifications, the incident further tarnished his credibility. Perhaps the most telling aspect of this entire saga is Phillips' behavior on social media. He thrives on public criticism, often using sarcasm and personal attacks to dismantle his opponents. Yet, when it comes to addressing the contradictions within his own professional environment, he remains silent. If he were truly committed to scientific integrity, he would resign from Rajajayari Hospital and join an institution that aligns with his professed standards. Until then, his online sermons ring hollow. The real question is this: if homeopathy and Ayurveda are pseudoscience, shouldn't faith-based healing be held to the same standard? And if Phillips is unwilling to challenge the practices within his own hospital, can he truly claim to be a champion of scientific truth? The answer seems clear: his courage exists only behind a keyboard, not in the real world where it matters most. 5. Why critics can't ignore yoga and Ayurveda: Insecurity and Intolerance exposed. Imagine this: centuries of healing wisdom, passed down through generations, suddenly under attack. This isn't just a social media spat, it's a full-blown assault on an entire civilization's medical heritage. But here's where it gets controversial. The recent surge in criticism against yoga and Ayurveda isn't just about skepticism, it's rooted in deeper issues of insecurity and intolerance. Let's dive in and explore the nuances. It all started with a seemingly innocuous post by Indian chess Grandmaster Vidit Gujrathi, who honored his family of Ayurvedic and homeopathy doctors on Doctors' Day. Little did he know that his tribute would spark a heated debate. A Twitter user, Cyriac Phillips, a practitioner from Kerala, chimed in, claiming that Gujrathi's family members weren't actual doctors. This comment, backed by a few others, escalated into a broader attack on Ayurveda, yoga, naturopathy, Unani, Siddha, and homeopathy, labeling it as a pseudoscience. Now, it's perfectly fine to critique any medical system, including those rooted in Indic traditions. But when the criticism turns into repeated attacks and dismissals, it's crucial to examine the underlying motives. And this is the part most people miss. The civilizational knowledge and wisdom that have healed countless generations cannot be brushed aside so easily. Firstly, these attacks reveal a deep-seated insecurity within the allopathic community, which operates on the Western paradigm of modern medicine. Many allopathic practitioners adopt an exclusivist stance, believing that their methods are the ultimate cure, while dismissing all others as mere hocus-pocus. This mindset is not only narrow but also ignores the rich history and efficacy of traditional medical systems. Take, for example, the Rajajayari Hospital in Kerala, where Cyriac Phillips is a senior consultant. The hospital proudly offers chaplaincy and pastoral services and proclaims its commitment to invoking the healing power of God. This blend of spiritual and medical care is a testament to the holistic approach that many traditional systems embrace. Yet, Phillips denigrates Hindu scientists who show any sign of spiritual belief, highlighting a glaring double standard. Secondly, it's important to note that Ayurveda and homeopathy are recognized medical courses in India. Students must clear the National Eligibility Cum-Entrance Test, NEET, to pursue degrees like BAMS, Bachelor of Ayurvedic Medicine and Surgery, and BHMS, Bachelor of Homeopathic Medicine and Surgery. These degrees equip graduates to practice as doctors in their respective fields, contributing significantly to the healthcare system. Western medical institutions are increasingly acknowledging and integrating Indian medical systems into their practices. For instance, Gerhard J. Mueller, MD, from Albany, New York, wrote in the New England Journal of Medicine about the ancient knowledge of testicular function, citing the Ayurveda text written by Sushruta around 1400 BC. Columbia University credits Sushruta for pioneering plastic surgeries and nose jobs, documenting over 1,100 diseases and hundreds of medicinal plants in his work, the Sushruta Samhita. Dr. Timothy McCall, in his book Saving My Neck, A Doctor's East-West Journey Through Cancer, shares his experience at an Ayurvedic clinic in Kerala. He witnessed a young woman with rheumatoid arthritis, who was bedridden despite heavy Western medication, slowly recover through traditional treatments. This story underscores the potential of integrative medicine, combining the best of both worlds. But here's a thought-provoking question. Why do some practitioners in the land where integrative medicine was born want to suppress ancient knowledge instead of exploring it? Mark Hyman, MD, former director of the Cleveland Clinic Center for Functional Medicine, advocates for an integrative approach as the future of healthcare. Yet, there are those who prefer to dismiss rather than understand and integrate. In conclusion, the renewed attacks on yoga and Ayurveda are not just about medical skepticism, they stem from deeper issues of insecurity and intolerance. It's time to embrace a more holistic and integrative approach to healthcare, one that respects and learns from all medical traditions. What do you think? Do you agree that these attacks are rooted in insecurity and intolerance, or do you see it differently? Share your thoughts in the comments below.